Advicor is a combination medication that contains two active substances, niacin, nicotinic acid, and Lovastatin. Niacin is a B vitamin that helps lower cholesterol and triglycerides. Lovastatin belongs to the statin class of drugs and works by reducing the production of cholesterol in the liver. Indications. Advicor is typically prescribed for the management of elevated cholesterol levels, specifically hypercholesterolemia, high levels of cholesterol, hypertriglyceridemia, high levels of triglycerides, mixed dyslipidemia, elevated cholesterol and triglycerides. How to use. The dosage of Advicor is individualized based on the patient's lipid profile and health status. It is typically taken once daily in the evening. Advicor is taken orally with the evening meal. It is important to follow the prescribed dosage and administration instructions provided by the healthcare provider. Contraindications. Advicor is contraindicated in the following cases: hypersensitivity or allergy to niacin, Lovastatin, or any components of the medication, active liver disease or unexplained persistent elevations in liver function tests, pregnancy and breastfeeding. Warnings. Regular monitoring of liver function is recommended during Advicor treatment. If signs of liver dysfunction occur, the healthcare provider may adjust or discontinue the medication. Advicor is often prescribed as part of a comprehensive treatment plan that includes dietary modifications. Patients may be advised to follow a low cholesterol diet. Limit alcohol intake while taking Advicor, as it may increase the risk of liver-related side effects. Side effects. Common side effects of Advicor may include flushing of the skin, upset stomach, headache, muscle aches. Serious side effects may include liver problems, myopathy, muscle problems, and an increased risk of diabetes. Any unusual symptoms or side effects should be reported to the healthcare provider.